In this edition of Your Health Matters, there are some things that are hard to talk about. For women, it can be pelvic pain or urinary incontinence. So today, we are with Dr. Megan Sneed to kind of break all of that down. She is a urogynecologist with HCA Midwest Health. And so let's first of all talk about pelvic pain. There's a lot of different types of this.
There's so many different causes of pelvic pain, and unfortunately a lot of women feel like they're not listened to as much as they should be when it comes to this topic, or they feel like it takes a long time to get a diagnosis, because pelvic pain can be some very different things. Women always kind of assume that everything that happens from their belly button to their knees must be their uterus, but pelvic pain can be from your intestines or your GI system, it can be from your bladder or urinary system, and it absolutely can be from your uterus or the structures around your uterus.
And talking about that, some of it can be with your reproductive system. And there are also some fixes, talking about robotic fixes. Is that correct? How does that all work?
Well, one of the most common causes of pelvic pain is a condition called endometriosis. It unfortunately plagues over 6 million women around the country. And the reality is, our newer studies are showing that sometimes that diagnosis is delayed over 9 years. So for whatever reason, we're reluctant to look and to see what's going on in a woman's pelvis when she's having pain. And a lot of times, undiagnosed or continually undiagnosed pelvic pain is endometriosis, which can cause a tremendous amount of scarring, pain, infertility, changes in your periods, all kinds of things. So sometimes doing surgery to help with that scarring or to remove that endometriosis is the only thing that can make a woman's pain better.
Okay, and let's switch gears a little bit to urinary incontinence. For some women who have this is, bringing extra changes to work, maybe of clothes, or staying home, or feeling like they can't go out and exercise. How common of a problem is this?
Urinary incontinence is so much more common than we think. It's reported as 30% of women. I truly believe it is a much, much higher percentage than that. Women don't want to talk about it. They don't want to admit that they leak urine. They don't even tell me. Sometimes they come to my office for that reason, and I have to ask, do you leak? What makes you leak? And there are so many different types of incontinence. They're all treated different ways. Some women don't seek care because they fear it means surgery. Not all incontinence is treated with surgery. In fact, the majority of it is not. Even the types we treat with surgery, there are non-surgical options for treatment too. So it's always best to really dig in and figure out what's causing it, because it might be an easier fix than you think.
Absolutely. And what are some of the risk factors for somebody who might get this?
The typical risk factors are having babies, big babies. You may not have even had a vaginal delivery. You can have a C-section and still have incontinence. Incontinence increases, all types of incontinence increase with age, and a lot of it is just the skin you're made of. Genetics plays a big role in incontinence.
And what are some of the ways that people can fix this issue?
Well, it depends on the type of incontinence. There are types of incontinence that are easy fixed by modifying your diet, types of incontinence that are easily fixed with physical therapy. There are surgical options for some types of incontinence also.
All right, thank you so much, Dr. Sneed. That was all good information. So for this edition of Your Health Matters, I'm Jay Degood with 41 Action News.